One of the important questions we have when we are giving immunotherapy to our patients, and particularly from their perspective, is why sometimes immunotherapy does not work. Is it the time that it takes to give the treatment? Is it compliance? Or do we have personalized, relevant biomarkers that can allow them or tell us why they're not going to respond or whether they're going to be responding? Well, it's very important that when we think about treatment effect, firstly, the patients need to take it for a course of 3 years, because we know you need to give immunotherapy for 3 years. If you give it for 2 years, there may well be that it's not as effective or the treatment doesn't last beyond discontinuation of treatment. The other element is important is that we are making huge efforts in identifying biomarkers in a precision medicine approach. In using precision immunology, there are novel tools that are now available which will tell us the variability of response within different patients. And this is really important. What we now know, for example, for those who receive subcutaneous immunotherapy, so this is grass pollen or house dust mite immunotherapy via the injection route, particularly what happens here, there is a very specific type of antibody that is induced, and those type of immune response will tell us whether the patient is likely to respond or not. Now, we also use sublingual immunotherapy, so it's you put a tablet under the tongue, and that elicits a different type of antibody, an IgA1 and IgA2 type of antibodies. And these are very relevant, so as they are coming up, we can measure them and detect them in the blood. We're able to then say that this particular patient is likely to respond. If we do not see any antibody responses, if we do not identify any signal in the tests that we do in the clinic, then we're likely to also identify those patients who are not likely to respond, and maybe a different type of treatment may be more useful or more relevant.